Welcome everyone. Again, my name is Jackie McLaughlin. I'm the director for the pre-health program. If you can keep your microphone on mute, that would be really good. And we have a lot of people in the Zoom room tonight, so it's probably best that we use the chat room. Faye Patterson is here with us, and Faye is our program coordinator, and she's going to be helping me to keep track of questions that are in the chat room. And we're also joined by one of our admissions specialists, Amy Mulhern, who sort of is the wizard behind the curtain and keeping everything functioning well while we're on this information session. So welcome to everybody. I'm glad that you're able to be here with us this evening. And I hope that you're all coping really well with all of the recent changes that we've had with COVID-19. Hopefully your life hasn't been too disrupted. I think one of the great things is that I'm really glad that we're able to have this virtual information session for you tonight, and that we're able to continue to receive applications and move forward with your applications to those people who are interested. So I think that's really a good thing. Hopefully all of you have had an opportunity to take a look at our website and understand a little bit about our program so that you can ask specific questions tonight. If not, maybe while, if you want to, just take a peek and scroll through there as I'm talking, and you can get a sense for what the programs are all about. I did have a little video to play for you to introduce you to the pre-health programs, but I wasn't able to get that downloaded onto this computer. So you're just going to have to put up with me talking for a couple of minutes to give you an overview of the programs. At the University of Pennsylvania, in the post-baccalaureate pre-health programs, we have essentially two distinct programs. We have the core studies program, which is for students who would consider themselves a career changer. So that's for the student who studied something other than a science, a basic physical science. You might have been an English major, perhaps a psychology major, and now you've decided that you want to go to medical school or vet school or dental school, and you need a lot of those basic core prerequisites to be able to submit your application. So that's our typical core student. And then we also have the specialized studies program, and that is more of an academic enhancer program for people who didn't study a science and they need to strengthen their science mostly through their GPA. So a lot of people are looking to raise their GPA to build a stronger application. But others want to come and participate in the specialized program because they want a little bit more time to do things like research, or they want a little bit more time to, experience some clinical settings before they submit their application, and really have assurance that they're on the right pathway, that they're on the right track. So students who are in the specialized program, not all of them, some of them come in with very high, very strong GPAs. So everybody's goals are a little bit different for what they're looking for from the program, okay? So that's just the general overview. And I'm sure as we go through the evening, hopefully everybody will have an opportunity to ask your specific questions. But I think what I'll just go ahead and do is jump in to the first questions that are already in the chat box. And maybe, I don't know, Faye, you might want to see if you might want to start to ask people to raise their hand. I'm not sure. And if we want to take verbal questions, but why don't we see how it goes? Because we could do it either way, okay? So the first question is from Paolo, who's interested in the admissions committee and whether or not the admissions committee reads your personal statement and essay from a prior AMCAS application. Yes, we do. So if you already applied to medical school or to dental school or to vet school, we ask you as a part of your application to the pre-health program to submit a copy of your application, whether it's AMCAS, ACOMAS, VAMCAS, ADSAS. And we look at all of that. We look at your verified transcripts. We look at what you wrote as part of that application, because it's important to get a sense of who you are, how you applied. And oftentimes we can help students to modify their application if you're applying for a second time. So it's good for us to see what you applied with, what your application looked like, what was the outcome of that application cycle, and then how can we help you to strengthen your application if you're applying for a second, or for some students even a third time. Okay. Marianne's asking whether or not someone can apply to the program with a 2.7 GPA. Marianne, I don't know which program you're asking about. I would have to say that since there are two distinct programs, there's core and there's specialized, we kind of look at the GPAs a little bit differently for each student. So I would say for core students, a 2.7 would be a very low GPA. Students are mostly successful in this program when they have a 3.0 and above, okay? Particularly in the core, because people are usually moving from maybe social sciences or humanities into the physical and life sciences, which tends to be a pretty big lift for a lot of people. So we want to make sure that they're able to absorb information quickly and move quickly with that. So for specialized students, there are some students who come into this program with a GPA around maybe a 2.7. That might not be the overall GPA, maybe that's the science GPA. It really depends on the student and the reason why the GPA is at a 2.7. So we look at each application holistically. We look at your where you went to undergrad. We look at the courses that you took. We consider how you did freshman, sophomore, junior, senior year. We also take into account your personal situation. Are you the first person in your family to go to college? Were you working full-time and helping to support your family when you were in undergrad? There are a lot of reasons. Were you a Division I athlete, which basically is like having another full-time job? So it's all those pieces of getting to know you that we want to know in your application that help to explain why you might have a GPA around a 2.7. For some people, it was just they were immature and not self-directed enough. And now at a different point in their life, they're ready to take on other challenges. So we will look at that. I know it's not a specific answer to your case, but the best way to find out whether or not we would look at that is, to submit an application. And in your personal statement to give us information about you and why your grades are where they are if you had particular challenges. Okay. All righty. Hi, everybody's saying hi in the chat box. That's nice. Okay. I'm going back up here. Somebody, what does the post-baccalaureate program provide that is different from other post-baccalaureate programs? That's a good question. So I think students generally in pre-health post-bac programs look at about maybe 5 or 6 different programs. Our program is relatively large. So when you're looking at programs, you want to get a sense of the size of the program. Is there a community in the program? So we have a pretty vibrant pre-health community, a lot of clubs and student interest groups that people participate in, and a lot of those things really expand and provide sort of an enrichment to your academic experiences. It also provides students with new opportunities to demonstrate leadership. And leadership is a very important piece of your application. Penn is also a very competitive environment academically. So that might be a really nice step up for some students, you know, depending on where they went undergrad. They might really want to show that they can handle a very rigorous curriculum to demonstrate to the admissions committee that they're up for the challenge of this next step to professional school. We also have a very, I think, a robust number of advisors for the program. So we basically have 6 advisors for the program, and 4 of them are also faculty who are teaching in the core and the specialized curriculum. I think that provides a lot of continuity and a lot of support to students. I think those are the best, you know, the things that help us to stand out. Also, Penn has fabulous health centers, so you're able to leverage the closeness, the proximity to the health centers at University of Pennsylvania if you're a student here. And that goes for dental resources, vet resources, and human health resources that are here. So you don't have that at every setting. So I hope that that answers your question. But if you have more questions, continue to add to the chat box, okay? That was for Ashley. And I'm moving down here, and Johanna is asking about a GRE date was canceled, right? And would my application be weaker if I end up sending in my SAT scores due to this reason? Yeah, that's a really good question. And I don't really have a good answer for that. I don't know what your SAT test results were, but I can tell you that we do need a standardized test score. So I know that the GRE is offering testing in home dates. So you might want to explore that. And if you really think that your GRE score is going to show a better standardized test result than you had with your SAT, then it might be to your advantage to go ahead and schedule that GRE and take the GRE. If you can prepare in advance for it, study, and submit those scores. You're going to have to use your best judgment about that. What we're looking for with the standardized test score is, particularly in the math, is that you have good quantitative skills. So you want to be able to demonstrate that in some way. So much of your progress in this field, in medicine, you're going to be subjected to a lot of standardized testing. So it's something that you kind of have to get used to. But it's just sort of a one point of comparison that we have to look at all the applicants for the program. So I hope that helps. If you have additional questions about standardized testing, please feel free, to add some more into the chat. Here we have Ming, who was an English major as an undergrad and no science background. And does the pre-health core program at Penn have built-in clinical hours? I'm worried that without integrated clinical curriculum, I won't have time to gain experience. That's a great question too, Ming. No, we don't have integrated clinical hours into the actual curriculum. But for someone who doesn't have much clinical experience, we would recommend that you look at applying to the core to start in the fall. And usually students who are starting in the fall will have 3 course units for the core. We start with chemistry and physics. And that is about 3/4 time. It's not full time. 4 course units would be full time. And that hopefully allows you a little bit of time as well, once you acclimate to the rigor, to start to spread out and take advantage of some of the clinical opportunities that are available to you here, like the Academic Associates Program and other types of programs like that. Usually that puts you on a 2-year timeline to complete your core courses, and it allows you opportunity to get clinical experience at the same time, and to also get potentially some research experience while you're here. It may seem like a long time to do it, but it's a lot of coursework. Most course students take, although the certificate is 12 course units, most students take at least 13 course units, and some take even more than that. So like the dental students might take more because they might have other prerequisite requirements. The pre-vet students often take more. They're taking physiology, usually comparative physiology and microbiology, in addition to those core courses. And there are a lot of options. So if you're here over 2 years, you can begin to take some advanced bio courses as well. That may put you in good stead when you start medical school as well. So I think I answered that one. And the next question is about massage therapy school in Costa Rica. It can take 3 to 4 months to send mail from Costa Rica, and I'm not sure that I could get transcripts. Would that be an issue? We do need transcripts. So we need, you don't have to start at any particular time. So the admissions for summer, I believe tomorrow, April 1st, is really the deadline for summer starts. But the fall start, there still is time. June 1st is when those applications should be completed for the fall. Depending on what your background is, we do take students in January as well. So specialized students can start in January, not core, but specialized students can start in January as well. So if that's the kind of lead time that you need to get your transcripts, now you can plan ahead, based on that. I know there can be delays. Some schools, there's no one in the registrar's office right now. Many schools haven't transitioned completely over to electronic transcripts. If that's your issue, just communicate with our admissions team and let us know, so we can let you know, what our plans are and how to handle that in the future if you're having trouble getting your transcripts. We'll help you with that process, okay? On the website, there appears to be personal advisors for the application process. I'm not sure if anyone else has this issue, but I do not know how to access these services. Would you perhaps provide some clarification on that, please? We do have, Brittany typically is the person who does a lot of outreach to our students. So if you have indicated wanting interest to know more about this program, she typically is the person who would be following up with you, either Amy or Brittany. So what I will probably do is ask Brittany to send sort of a follow-up email to people who were on this call. So you should be putting, getting in touch with that personalized, advising for the application process to help you through that, okay? Haley wants to know if she needs to send an official score report for her ACT or GRE scores before a decision has been made on the application. Right now, Self-report is good, but we really do like to have those official reports. So if you can send the official report, if you can get access to it and send it and have it be part of your application, it's much better because it's easier for us to review an application if everything is complete, the scores are official, the transcripts are there, and we're able to, get through the application, review it much more quickly, call you in for an interview if we want to bring you in for an interview, which of course now would be virtual, and turn around your application or your application decision more quickly. Okay. Kyra has a question. Oops, I'm sorry, I skipped Molly. Here's Molly's question about specialized studies. Are we able to take some core pre-med requirements as well? Yes. So while we have two distinct programs, core and specialized, we have a lot of students who apply to the program who are somewhere in between. Maybe they had intro bio, or maybe they had intro chem. Some people, maybe they're engineers and had physics and don't need to retake physics. So some students will start somewhere in between. And we will individualize a plan for you that way. And probably the best way to approach that is through your admissions interview, the very first step with your admissions interview. We'll take a look at that transcript and see, well, this is great, and maybe, there's continuity here between these subjects, and we think a basic plan for you would look like this. And then when we all come together as an admissions team, we talk about the best plan for you as well, with all of the advising team present. And if it's something other than what you discussed in that admissions interview, Faye will typically set up a pre-advising consultation between you and I, so that you and I will have a one-on-one conversation about what it looks like, what we think is the best pathway for you, and then allow you to make a decision about what you want. I think that's fair, so that when you're looking at a program, you want to know before you commit, what is my plan going to look like, and how are you going to help me fill the gaps and meet the needs that I have. So we want to make sure that you have a clear understanding of that before you come to Penn. Okay, we'll definitely work with you on that. We have a lot of students who fall in between, so it's not unusual for us at all. Okay, so the next question was about work experience. So we look at all the experience in your application. We don't have a certain type of work experience that we're looking for from students, because everybody's different. This is such a diverse group of students that we have here at Penn. Some have a lot of clinical related work experience, some have a lot of research related work experience, and some have none. So particularly for somebody who's coming from a different field, they might not have anything that relates to work experience that other students might have. We do look at all of it though. So we consider what kinds of experiences people have. We look at your maturity. We look at your, commitment. We look at your motivations for doing this. And some people might want to come into the core program and think, well, I can continue working in my current field while I do this. And it's often a big surprise for them to find out that, well, you really can't. It's very hard to work and do the core studies program, just because it's all laboratory courses and it's very time demanding. We have had students who do it, but we don't recommend it. So those are the sorts of things that you want to talk with your interviewer about, my past work experience, and I was planning on working, and how much can a person work, and so forth and so on, and have a very realistic expectation about how you're going to be able to succeed in this program. Okay. So Gian wants to know about, for the dental school program, does it look bad to take science classes such as microbiology over the summer at your institution online? Wow, I think that particularly in this day and time is a complicated question, because generally it doesn't look bad to take any science courses at all. And if you need science courses, you need microbiology for a dental program, it's great to get it out of the way. But at your institution over the summer online, I'm wondering if it's online because of COVID-19. So just as what is happening this semester is that many of your face-to-face classes have had to be transitioned to remote learning or distance learning to complete the semester. For many schools, they're also doing the heavy lift of transitioning a lot of their summer courses to online as well, so that students can continue with the courses that they need. Microbiology, I think, is a really tough course to do online. You might be better served to contact some of the dental schools that you're looking at and see what their policy is right now about summer courses. Because I think there's a lot of uncertainty right now, and there's a lot of flexibility and differences from school to school at how they're looking at things like pass-fail, how they're looking at summer courses, and so forth and so on. So I don't have enough specifics to give you, a definite answer to that question, but I think that it's a good question to ask. Good question to ask about summer courses. Paolo wants to know about the flexibility on the April 1st deadline for summer. Would it still be possible for you to start taking classes this summer and finish after the fall semester? So specialized studies, Paolo, is 8 course units. So that's at least 2 full semesters. And right now, I do not have a definite decision on which courses specifically are going to be offered for this summer. We're working very hard on it. And we're working with the university administration on trying to figure out what are the best courses for us to offer this summer. Even if it was a normal summer with the normal course offerings that we would have, the entire array, you would not be able to do 4 course units in a summer. That is next to impossible, because a normal semester is 14 weeks. And we condense that 14 weeks into 5.5 weeks for the first summer session, 5.5 weeks for the second summer session, and then we have a full summer session that's 11 weeks. So the courses are just too condensed to think about taking, a lot of different courses in the summer. So depending on what courses you need, we may or may not have those courses running this summer. I would say I don't recommend more than 2 course units for a specialized student in the summer. And so that would mean that you'd be looking at fall semester and spring semester to complete the specialized program. So you really would be looking at summer, fall, spring, or you could do it just fall and spring if you wanted to. And if you miss that deadline, the April 1st deadline, you can apply for the fall. As I said, that one is June 1st, okay? Okay. We have a 41-year-old career changer. Good for you. Who's interested in the program and what appears to be a comprehensive approach to making the change. Great. Um, I read some information about possibly starting in a part-time. I'm assuming PT means part-time. From a financial perspective, I may be interested to do that. Okay, and transition to full-time, that is possible. You can start this program part-time. Part-time typically is two course units a semester. 2 course units is 8 credits. All right, so a course unit typically translates into 4 credits. So 2 course units a semester would be considered part-time, that's half-time. And we have a lot of students who are working part-time and doing that as well. For career changer, though, that's harder because of the types of courses that you have. So a career changer typically is taking 3 course units a semester on a part-time basis, because those courses you're taking are lab courses, and that adds an extra half a CU to each one of the lecture components. So that's a pretty big difference between core and specialized because of all the laboratory requirements. It's much more time, it's a lot more work, and that's where we really do not recommend that, that you're working at that time. If anything, just very part-time. You can move between part-time and full-time. So there's that flexibility within both the specialized program or the core program to move back and forth between part-time and full-time as your personal needs demand. You would make those changes in consultation with your advising team. Okay, so it's very important to have pretty frank conversations if it's financial needs, whatever the needs are with your advising team, so that we can partner with you and help you make the best decisions to be successful in the program. Okay. So, okay. So I just learned that there's no raising hand option, so that's okay. I know that some of you are getting answers from Faye privately, so if I'm repeating things, if it's redundant, I'm sorry, but I'll just continue going down the list and see how we do with this. So Evan, you're very welcome. I'm glad to be here. Glad you're here. Your question is about clinical and research experiences. Are students able to be involved in a clinical setting as well as participate in a research project? Do students get to choose specialties or specific clinical settings? We have a great opportunity here at Penn. It's in the emergency room of the Hospital of University of Pennsylvania, Presbyterian Hospital, and Children's Hospital. It's a program called the Academic Associates Program. And in that program, students get both clinical exposure and clinical research experience. So do you get to pick sort of what specialty area or service you want to work on? No, not necessarily, because you're working in the ED, you're working in the emergency room. What students are doing, you're trained with recruiting people into studies and there's an array of studies. So you learn about all the studies that are being conducted there. You learn how to recruit people, how to interact with people in the ER. And then you follow them, for a period of time. And while you participate in that program, it's about 6 hours a week. And while you participate in that program, you're also meeting attending physicians and you're meeting residents, and you can actually develop connections with them, and you can ask to shadow them on another service, and you can get exposure to what their daily routine is like, if it's different than yours, and you participate in consultations about the studies, and you understand research protocols, And if you stick with it for 2 semesters, you can actually begin to do your own research under the guidance of another PI with the program. And for a lot of students, this actually ends up resulting in them getting and this is volunteer, so it ends up in them getting a paid position for maybe more hours, maybe 12 hours or 20-hour a week clinical research position in the university. So it's been a wonderful opportunity. It's competitive to get into it. Students apply to it at the beginning of every semester. We post that information for students, and we've got a great relationship with the program. So that's been a great benefit to a lot of students. That's just one way. We have a lot of other, there are a lot of other resources for accessing clinical opportunities and research opportunities at Penn. So there is a database of undergraduate research opportunities at Penn, and we can point you to that, and you can look for different areas that you're interested in learning more about. Maybe it's heart disease, or maybe it's a particular type of cancer, and you can look for opportunities there, and they might be unpaid or paid positions. So there are a lot of ways to look for how you can really use the proximity to those clinical settings to get experience and opportunity as part of your application. I've never seen a student come to Penn who didn't find great opportunities. Sometimes it takes a semester. It doesn't always happen right away, but I've seen every student be able to benefit from that. Okay. Does the program have dedicated facilities, or is it combined with the general pre-med classes? Thank you. That's a great question, Kelly. No, we are not with the regular undergrads. So in this program, you are taking classes with your peers. So that is all pre-health students. So pre-health students have priority for registration into our classes. There may be students who are post-bacs who are not pre-health, who are waiting. They might be on a wait list to get into these classes. And there might be some other students across the university, maybe from another school, who might want one of these classes for some reason because they can't have a conflict with their day class. But they have to yield priority to the pre-health students. So our classes are offered in the late afternoon to the evening when we have space in the university. And so they can go quite late, up to about 9 o'clock at night. But it also gives you opportunity then during the day to either work part-time or be doing research, definitely to be studying, and you're building a network with your peers. And I think someone asked me earlier, what are the benefits of this program? I think that's a huge benefit of this program. We have a peer mentor program, and every new student, when you come into the program, is assigned to a peer mentor in the program. Somebody who's already at least been here 1 semester longer than you have, and can kind of show you the ropes. It's someone to say, hey, are you going to that happy hour or bowling night? That sort of thing, so that you know people, and can sort of feel like you get connected to a bigger community. Students have study groups. We encourage you to develop relationships with your peers so that you're working in teams to study and support each other through the process. And students make really lasting, binding friendships through the program, which I think is really good. So I think it's truly a benefit that you're with pre-health students and not intermingled with the rest of the university for your classes. Your faculty understand that as well. So while you might take an organic chemistry class during the day, maybe the instructors are hoping you're going to be an organic chemist, but our instructors know what your path is and are wholly supportive of pre-health, the pre-health pathway for you. We know you're not going to be a physicist, okay? So we want you to learn the physics. We need you to learn the organic chemistry, but they're really wholly supportive of the pre-health pathway. Okay, are courses specific to post-bac students, or are they shared? Okay, I think we just kind of answered that. And are the Advisors Club volunteer opportunities also specific to post-bac students? So yes, the pre-health students. So all of the advisors that we have for the program, myself, Danielle Lever, who is a full-time advisor, and the 4 instructors that I talked about, John Zimmerman, Lisa Whitmer, Ariana Hall, and Sukalpa Basu, who make up our advising team. They are only advisors for pre-health. Faye also does some advising as well, who's our program coordinator. So she assists with some advising as well, and only for pre-health. The journal clubs, the student activities, the groups, they're all pre-health. So they're sponsored by the program, and we keep them, usually almost all of them, limited to just pre-health. Every now and then we'll share with maybe a career services. So NYU is coming to campus to visit soon, and well, they're actually going to be doing a remote visit now, and we're sharing that with the undergrad career services. But normally everything is exclusive to pre-health. Okay, I hope that then answered that question. Okay. Offhand, what is the typical student to advisor or professor ratio? Well, there are 6 advisors and there are about 275 students, so you can do the math on that, okay? It's an open advising system, meaning you're not assigned to just one advisor. You have a team of advisors, and you can come to any one of us, the first available, your favorite, whatever. So we take notes on our advising session with you so that you have continuity from one advisor to another. And I firmly believe that this gives you greater access to advising when you need to see an advisor. So that's about the ratio for advising. Now for faculty, I don't know. I've never really looked at the faculty ratio. We have basically, if you look at all the courses, it's a good idea. I should look at it, but it's pretty good. I mean, we have, if you look at the number of courses that we run every semester, there is a different faculty member for every course that we run, and we have a good depth and breadth of courses in the program. So I think that faculty are very accessible to the students. I've been here for 7 years now, and I just think it's a phenomenal group of faculty teaching. And they really are dedicated teachers and educators. So exactly what that number is, I don't know, but I'll take a look at it. I think it's a good number that I should probably know. Okay, moving on. Volunteer and clinical hours, part of the curriculum. No, volunteer and clinical hours are not part of the curriculum. We covered that a little bit earlier, but there are lots of opportunities to pick up those kinds of experiences. And Patrick is also asking about MCAT preparation. Some other programs integrate MCAT prep into their program. Many of our students who come to this program already have taken the MCAT and don't need to retake the MCAT. That might be for the specialized student. Others do want to take the MCAT again, maybe repeating, but they maybe want to prepare a different way than they prepared the last time. And then for many of the course students, of course, they need, to prep for the MCAT. So we have partnerships for MCAT prep. We have a partnership with Kaplan, and we have a partnership with Princeton Reviews. And Kaplan is live online with their live online program, and we offer a significant discount to students. So instead of rolling in the cost of the Kaplan program into tuition and fees, we let students choose, is this the program, how I want to prepare for the MCAT, okay? You might want a face-to-face class for your prep. So maybe you would like what's being offered, the discount that's offered through Princeton Reviews. So there are a few other options. There are actually some students who are re-prepping for MCAT who want an individual tutor this time around. It's great to have that conversation with your advising team. We do have some options for discounts for you for MCAT prep, but we don't have it built into the program because I like students to be able to have the flexibility to choose what suits their learning style or what suits their needs at this point in time. That seems to work pretty well for our students. Okay, do students in the specialized program typically have time to participate in research? Yes. So for our part-time students, a lot of the specialized students are part-time and they are working in research at the university. So they get a lot of really good experience that way. Are there opportunities to obtain a committee letter? Yes, we do provide committee support for your application for medical school. That includes allopathic and osteopathic school, and for dental school. Vet school, the pre-vets do not need a committee letter, but I will provide an individual letter of recommendation from the program if needed. And committee letter, we do. You have to maintain at least a 3.0 in the program, you have to have completed the required course units. So that's 8 course units for the specialized program, and it's 12 course units for the core program. There are some more details about that, which again, we could talk about at an admissions interview. But yeah, and we're going full speed ahead with our committee letter process this spring. So I'm really glad we went through a lot of building everything to be online for this cycle through Interfolio in-house. And I am so glad we did, because we would be having a really difficult time with our committee letter process this spring if we didn't do that. So I just, I am so grateful that we did all that work in the fall. And we have over 80 students, first-time applicants from our program who are applying to medical school this spring. And then we might have about 20 or so reapplicants that we're supporting in that committee process. So it's a lot of letters, a lot of students. So we're happy to do it. How might success in this program translate to graduate opportunities? I'm not sure. Are the professional school linkage agreements offered to most students, and what would the benefit of participating in the linkage agreements? Okay, so Maggie, I'm not sure what you meant by the graduate school opportunities. So if you want to be a little more specific about that, maybe I can address that a little bit later on. but in terms of linkage. So the linkage agreements are articulation agreements that we have with specific medical schools, and we have a couple with a couple of dental schools. And they basically are an early admission agreement. So you would end up matriculating in the same year in which you're submitting your application. So it eliminates the glide year, because the normal application cycle is a full year. You apply a year before you matriculate. So if you're accepted into a linkage program, you are applying and matriculating in the same year. Are the linkage agreements open to most students, was another part of that question. Well, everybody's eligible to see if they want to apply to a linkage, but you have to meet certain basic requirements. You have to come into the program with a specific GPA in your undergrad years. You have to earn a certain GPA in your time as a pre-health student. For many of them, you have to have a specific MCAT score or DAT score to be eligible. So they set their specific guidelines for what they want in a linkage candidate. So it turns out that the majority of our students in our program are not getting into medical school or dental school through a linkage. The majority are applying broadly and getting in through the normal application cycle. But we have anywhere from 5 to 10 students every year who are doing a linkage with a particular program. Okay, I hope that answered that question. Glenna completed undergraduate degree as a nurse and is interested in going to med school. Great, we have several nurses every year, Glenna, so you won't be alone. I'm not sure whether I fall in between core or specialized. That's right, you may have to repeat some of those sciences. Your clinical experience is wonderful. So you certainly have that going for you, but usually it's where the hard sciences come in, that many of the nursing students have to do a lot of that work again. So what I would recommend, if you're really interested in Penn's program, is that you apply to one or the other. You could apply to the core, and if you applied to the core and we reviewed your application and we thought you'd be better off as a specialized student, we would tell you that. So that's one of those situations where the admissions committee would come back to you. They might schedule a pre-advising consultation with me, and we would talk about the best fit for you and let you know which program we would recommend. Okay. Hi, Tara. Your audio wasn't working. So can you repeat? Oh, flexibility with the, as mentioned. So the April 1st deadline, I don't know that there's any flexibility with that April 1st deadline. I have not talked to the admissions committee about it. Usually I look to see where we are with applications and how many yet have to complete their application. So I would say, if you haven't, April 1st is tomorrow. If you haven't started an application by now, I don't know how much flexibility there can be, because there's your application has to be reviewed, then you have to have an interview. So, and then classes start in May. So I can't really stretch out that window much farther, because there isn't a lot of time for the wheels to turn and do all of that in that timeline. So that's why we have to cut it off at some point. So probably for people who've started an application and think they can get it completed within a week or so, we may be able to still review those applications for summer. But for other people who haven't started an application yet, if you can't turn it around, really, really quickly, I'm not sure that we can extend that deadline just because there isn't enough time to get you interviewed and then have a turnaround, a vote in that time. So look to the fall. You know, a fall is probably even a little more stable time. We'll know a lot more about, you know, what's going on with classes and things like that in the fall. Okay. Okay, another question about committee letters. So who may qualify? I thought I covered qualifications for committee letter. You have to meet the CU requirements, which for core students, excuse me, I'm going to sneeze. For core students is 12 course units. And for specialized students, it's 8 course units, and you have to have a minimum of a 3.0. Those are the basic requirements. If you have multiple W's, that's going to be a challenge as well. But those are the basic requirements right now for committee letter. Penn Specialized Studies is one of my top choices, and I wanted to know if there's an option to create your own schedule based on classes needed to apply to dental school. I would have to say, Deja, I hope I'm saying your name correctly, that we do a lot of individualizing with your coursework. So that's definitely why advising is really important. So we would want to look at what courses you've had, what courses you need to take, so that you're maximizing your chances to meet requirements for the majority of dental schools that you're going to be applying to. It's not exactly make your own schedule, because you can only take classes when they're offered, but it's so that we can help to guide you with what those course selections would be and let you know in advance, well, you have to take this semester because it's only offered once a year, you know, kind of thing, so that you don't miss a critical course that you need for those pre-dental requirements. Okay. Part-time or evening options. Yes, all of our courses are in the evening, and students may be part-time or full-time. All right. Scrolling down through questions. Ooh, international student applying to vet school. International students are a special case. We have very few international students in our program because international students need to be full-time. So if you are applying as an international student, you have to have a summer start if you're a core student. It's much easier to be an international student as a specialized student than you can start in the fall. But all of you have to be full-time, and you have to complete it within a year. Those are the visa requirements for international students. All right, here's another question. I know I've taken classes where the course is compressed. Are there course options available and possible to take evening and online versions? All right. Our summer courses are compressed. Many of them are compressed from 14 weeks into 5.5 weeks, or they might be compressed from 14 weeks into 11 weeks. And all of our courses are in the evening, with the exception of summer. So summer are rostered all throughout the day and the evening. Is it possible to take online versions? Well, it appears that this summer we will have more online options available. We have online anatomy courses, 6 options of online anatomy courses that were developed by Perelman School of Medicine for us, and they are dynamite. So right now, we typically limit students to 1 course unit of anatomy. But during the summer, we're allowing students to take a little bit more if it increases their ability to get in credits that they need, just because we're uncertain right now what courses we can offer. Some of our regular face-to-face courses are being offered in an online format this summer. So we're in the process of transitioning some courses to online, but they probably won't continue to be online throughout the regular year. There are lots of questions about what online courses medical schools or vet schools or dental schools will accept. So we have a bit of caution about that as well. We don't want you to jump into taking everything online, because we want to make sure that your coursework is going to be accepted when you go to submit your applications. Okay. Is the curriculum tailored for what you need to take? Yes, it is. We try to do as much tailoring and individualization of your curriculum as possible. We have students who are engineering majors, who are physics majors, and no, you don't need to take, if you've had the courses that you need, you do not need to take them again. We don't want that to waste your time like that. We want you to move forward and advance with your coursework. Okay, the only time you need to take something over is if your coursework was maybe 10, 15 years ago, you're going to need to have recent coursework. Or if you had maybe a low grade, a particularly low grade, a C-, you might want to consider retaking that course. But that's the only time, you know, and we have discussions with you about that. Because many schools will not accept a prerequisite course that is a C- or below. So, but for the most part, if you've already done, you know, physics and you've been out working in the field, there's no reason for you to go back and take introductory physics at all. We would want you to go forward with advanced bios. In addition, I read on the website that Penn supports international student for up to 2 years. I don't know where you read that, because that's not the case. A international student in the pre-health programs has a year to complete the program. We may support your application for up to 2 years. But that does not mean that you have 2 years to complete coursework. So that's very particular to international students, okay? And that has to do with visa requirements. During the academic year, oh, this is from Faye to everyone, okay? All right, thank you, Faye. Is it possible to apply to the April 1st deadline for the specialized program? And if the application cycle, and if the application is rejected, can it be pushed to the fall? Hi, Parth. Yes, it's possible to apply to the April 1st deadline for the specialized program. If your application is rejected, no, you can't apply for the fall. You can apply for the previous year or for the subsequent year, but you can't submit an application twice in the same academic year. Okay. So if you think you need more time to put a stronger application together, you might want to think about applying to the fall and not rushing to submit an application tomorrow. Samuel came recommended from Columbia Postback. You're a 41-year-old engineer who's interested in the program full-time basis. Excellent. We've had many engineers come through the program, so we're very familiar with that. Gone back to school, but it's taking a long time. You're interested in the specialized program. Okay, how do you advise me to proceed with the application? Is it possible for me to join in the summer or the fall? Okay, so the best thing is to put your application together. If, again, the deadline for summer is tomorrow. So that's a very quick turnaround, but you might want to look to the fall to submit that application. But really just, getting your transcripts together, getting your letters of recommendation together, we'll take, a very hard look at it. And, again, it's not unusual for us to have engineers. I love the engineers. I think, you come with great problem solving abilities, which is really good. I understand that it's an investment you're willing to make to transition, so we'd like to partner with you in that process as well. So go ahead and submit your application, and we'll help you through the process. Okay, can someone apply to the specialized program with science courses that were taken 5 years ago? That's a really good question. So some of it depends, we want to look at it, and some of it depends on how did you do in those courses that you took 5 years ago, and have you been working in a science-related field? So again, that might be a very individualized kind of response. For some people, many schools, once your coursework is 6 years old or so, they really want to see more recent coursework. So again, it kind of depends. If you were a straight A student, 4.0s, and they're 5 years old and you've been working in research, well, maybe you don't have to repeat any of those. So we would want to take a look at your application and then be able to make a more personal recommendation to you about something like that. If someone is making a transition from working full-time to not working, when filling out the FAFSA, is there any consideration for that in aid qualification? Well, for our programs, for the certificate programs, we do not offer university financial aid. You would have to fill out a FAFSA. You would have to, there are federal loans available for both programs. So you can borrow from federal loans. So you wouldn't qualify for aid, but if not working, you would need financial assistance. Right. So you can only borrow a limited amount on the certificate program. So what you might be able to borrow may not be sufficient for you to meet mortgage needs, living expenses, those kinds of things. You might need additional sources of support, or you might need to think about maybe working part-time, or maybe planning ahead to save and maybe, applying next year so that you have more of a nest egg and a cushion to do this. But yeah, the amount that you can borrow on the federal loans is limited, and it may cover tuition, but it's not going to go very far in terms of your living expenses. Okay, Amy Cicina is wondering about if you can place out or move into the next course in the sequence. Do you recommend that if we're able to take a course or two over the summer before potentially enrolling in the fall? Have students done that in the past? We don't have an option to place out of anything, Amy. So whether you're core or whether you're specialized, you're taking the courses that you need. So cores take a minimum of 12 courses, specialized take a minimum of 8. So if you already had your Bio 101 and 102, well, you're not placing out of them. You just don't need to take those. You'll go into advanced bios instead to meet those credits. I hope that makes sense. We're not making you repeat courses, or you can't reduce the amount of credits for the program because you've taken maybe a different subject. You still need to do the same amount of credits. You'll just do it in advanced coursework. If you start in the summer, typically students are starting with the program in the summer, so it's not as if you're taking courses in advance before you come into the program. You're usually taking something that's going to qualify for the program. The exception to that might be math. So particularly, I'm talking to the course, the career changers out there. This is a math intensive program. If your math is kind of weak or you haven't seen a quadratic equation in years, you want to actually maybe take some math this summer. That's probably going to do you so much more good than anything else, or trying to get ahead or opt out of other courses. But taking a pre-calculus course or a calculus course this summer would be fabulous, because that's the tools that you need to do physics and chemistry. Okay, so that's one fabulous way that you can really use the summer to prepare yourself for jumping 2 feet into the sciences. I had to do it many years ago, so it's really good advice. Is it possible to schedule a one-on-one informational interview with one of the admissions counselors at the pre-med post-bac program? Yes, there are pre-advising sessions available. Again, Brittany will most likely be the person following up with you, and you can certainly schedule an appointment with Brittany. And then if you have additional questions that she's not able to address, she would be happy to schedule something else for you. Are fee waivers being offered to applicants? No, we don't have any fee waivers available. If you're talking about application fee, we don't have a program for waiving the application fee. And here's another question, something about the chat history. Okay, Faye, maybe you can jump in on Ming Zhu's questions. I'm not sure what the need is there. Anthony, I'm glad to be here. I'm glad you're here too. I'm glad you're getting your questions answered. It's hard for me to listen to myself talking the whole time, so I really apologize for that, but it's the only way to do it. One question that Anthony has is on partnerships and pathways post-program. You saw that Penn is affiliated with many medical programs and hospitals in the greater Philadelphia area. Does Penn have any relationships with programs on the West Coast? So post-program, usually most people are applying to professional school post-program, so that would be for medical school or vet school or dental school. So we have students, a lot of students from California, who come east and do this program for like a year or 2 years and then go back to California. And they're successful with application to California schools or schools on the West Coast. We don't have any particular affiliations like if it's job placement or anything like that, but our students do very well with getting into schools that they're applying to on the West Coast. I'm not quite sure if that answers your question. We also I have relationships with a lot of advisors for programs on the West Coast, because I belong to national organizations where we meet professionally, so I know a lot of advisors and a lot about programs on the West Coast, but we don't have any kind of formal relationships. Faye's posted something about financial aid, so take a look at that. It may be more informative than what I've been able to tell you about. If we already submitted an application for the fall, is there any way to begin part-time this summer before matriculating as a full-time student in the fall? Sometimes students are able to do that. So I spoke with a student just yesterday who was considering doing that. He applied for the fall, And after a consultation with me, he thought he might want to start a particular course in the summer. So we would be able to adjust his admission to start in the summer. But the only holdup to that right now is I'm not certain what courses we're offering this summer. And it's really late. I mean, my summer courses are up, you know, much before this. So that's the challenge right now. So if you're applying for the fall, apply for the fall. If the timing would work and a particular course that you might want to take is offered and available in the summer, we can have that conversation. But I can't make any guarantees because I just don't have the right answers for you right now. Maybe in a week. You know, our summer registration opens up on the 14th of April. So I need to know what courses are going to be offered in the summer. We're getting close. We're getting closer every day. So I'm sorry there's so much uncertainty, but we just have to be comfortable with that right now. Will this video be uploaded to the UPenn LPS website? Usually we do that. And where can you access it? Right on the Penn Pre-Health webpage. Usually there is, within a couple of days, we usually can add it to the website. And I think it's right on the front page of the website if you scroll down to the bottom. There may be one now from the last information session that we did. So we usually put them up there. And fee waivers, I already addressed that. No, we don't have fee waivers. Can you share how many remaining spots you have in both programs? I have space in both programs. We don't have, like some programs have X number of seats and that's it. Usually I have enough flexibility to be able to expand my program if the demand expands. So I might be able to add seats to a class. I might be able to add sections of a class. So I'm not as limited in terms of numbers. So don't worry about that. It's more about being able to get your application completed and get your application in to be reviewed within the timeline that we have to work with. Okay. Getting down. Wow, Faye, am I getting towards the end of the messages? Are we making any progress? We're already at over our time for this. So let me try and pick up a couple more questions. Oh, thank you. Please take a water break. I have tea right here. Advice for applicants that would leave a favorable impression on the admissions committee. I think just being yourself. We really want to know about you and who you are and why you want to make this choice, why you want to go down this pathway. The more that we understand about you, the more that we can help you and partner with you through this experience. This is going to be my last question. Are standardized test scores, MCAT, GRE required for application for people with work experience? Yes, they are. We need a standardized test score. I explained at the outset that GREs are now available for you to do in home if you don't have standardized tests. So it wouldn't prevent you from applying. You would be able to apply. And letters of recommendation are important as well. Academic, we like to see academic letters of recommendation, but of course, if you've been out in the workforce, we definitely want you to have recommendations from people who have supervised you and can talk about your skill set. Okay, that's it, everybody. I have been talking nonstop for an hour and 20 minutes, and I apologize for that. But I hope that you've been able to get all of your questions answered, or at least most of your questions answered. Thank you for hanging in there with me, and good luck getting your applications in. I might be a week or two, behind in reviewing them, but I'm catching up. you know, as we go. I'm starting to feel like I'm normalizing a little bit, and I hope that you are too. So good luck to all of you, and I'll be looking for your applications. Bye.